Well, we're here in the Dream Center, and we're in one of the free medical clinics, and we're going to talk on the dental side.
Correct.
So tell me a little bit of how it is that you came to be a part of the free clinics here at the Dream Center.
Well, in a nutshell, we had, Stevie, my wife, and I had heard that Daryl and Sandy had gotten off the ground the medical clinic, and so praying and thought, we decided that this was our calling, that we could establish the dental side.
All right, so you have a regular practice that you do? Is this a kind of a job on the side?
Well, we started in, well, we're going into our 5th year.
Okay.
And we started then in 13, February 14th by design, as a matter of fact. And at that time I was in my private office, semi-retired, and I'm fully retired now. But we decided we could make time for it.
All right. So take me through the process of somebody who needs to come in here to the clinic. Kind of who do you see and what's the process?
Right, exactly. The first important thing to know is that they should be seen at the medical clinics, which are the first and third Thursdays of each month, so that they have a health history and a health workup before the dental appointment is set for them. That way we're all clear and we don't have to jump back and forth.
Okay.
And then when they have their dental appointment, their first dental appointment, a complete exam with oral cancer screening and x-rays is completed. And we take that information and I go ahead and put together treatment plans for them so they can be appointed for each thing, because many patients that are seeking this type of care have multiple needs.
Okay. So success stories, or how, people that are coming, are you seeing a wide range of patients?
We are, yes. Basically it's been adults, simply because the kids have HAWK 1 in this state, so they're usually seen by specialists, but we've seen them from the 3-state area: southwest Minnesota, northeast South Dakota, and northwest Iowa, and some even further, but that's kind of regular. And we've started in the last year, 18 months, I'm going to say, of also seeing veterans that need help.
Okay, and how did that come about?
Well, word of mouth. They just found us, and we found out what their needs were and that they were veterans. They informed us, of course, and that they needed a little help because they weren't able either to travel to a vet center where there was a dental clinic, or that it was going to be quite a delay in getting started.
Why do you feel that having a dental clinic in a free clinic like this is so important?
Well, I think, as I mentioned to you before, I've been in practice here for 45 plus years, so I've seen the need. That was not a mystery to me. I've known that for some time, and that led us to being specific about what could be done and what the real meaning and service could be for a dental clinic, specifically a free dental clinic.
Okay, so someone's out there thinking, I could use that service. How do you go about doing that?
Okay, kind of reverting back to what I mentioned, is just to be here. Usually they open at 2 o'clock on a Thursday, first or third Thursday of the month, and they will be seen by either a nurse or the physician, and that way they've got a health history and the other things checked too, so it's multiple service to them. And at that time, then when they declare specifics about a dental need, that will be recorded and they will be given an appointment.
Okay, and then they just show up here and away they go.
And then they keep their dental appointments, and we set up a treatment plan, and we see them until they're taken care of for what we can do here. There are some limits simply because of what we're dealing with here and so on.
So if there are things that you can't deal with, do you have a place that you can refer them to?
Well, first of all, let me just say that what we're dealing with is limited oral surgery and restorations, which means fillings. For most people are going to think of it that way, and reasonable size. We don't get into anything because of laboratory work, any kind of dentures or partials or crowns and bridges, just simply because the lab. We haven't got any lab people on board. We'd love to have that, but we're very busy taking care of these basic needs for them We do work with the specialists in the area, which have really been great. We have some oral surgeons that are really great, and we are loosely associated with the federal clinic in Storm Lake, where they can, if we start them and take care of some specifics, they may go there and have a partial denture constructed.
Okay. So you mentioned you want some lab people on board. If there are some folks out there that want to volunteer, how can they get involved?
Well, call the Dream Center. I think most of the labs in the area know my name and know my contact information. But thanks for asking.
Yeah, no problem. Is there anything else that you could use that maybe the public could help you with?
Well, dentistry, the dental delivery of services always requires supply. And as you can see, the equipment that has been donated here, it takes regular donations to keep the supplies, and I would ask my wife to chime in on anything else that we have in mind about that question.
So you've obviously been working with your husband for quite a number of years. What do you find that you find most rewarding about working here at the Dream Center Clinic?
I love to be with the patients and to interact with them. We often see the patients out in the community, and they're not afraid to come up and give me a big hug and let the person know that they're with, you know, how thankful that they are for what we're doing, and we get so much more out of the experience, I think, than we give. It's been a true blessing. And I know Terry has said a number of times that because we do healthcare in other places in the world, you know, why are you doing that? Why aren't you working at home? Which we feel that we have really, you know, all of our lives. And it's not either or, it's both that God wants us to do. He wants to serve everyone, and so we're trying to do that.
All right. So he mentioned about maybe needing some supplies or some things that folks out in the community can help you with. So what kind of things would you be needing or looking for?
Actually, those are pretty specialized types of consumables, and so I guess I would encourage people that if they would like to give some type of a donation, that they maybe do it financially, and like if they wrote a check, it could be made out to the Grand Avenue Free Clinic with a special note for dental, and then we can use that to order the supplies.
All right, sounds good.
Thank you.
You're welcome.
Like you read.
Do you?
People ask us,
Are you still a chief?
how many patients do you see?
I thought they had a pretty good year.
And Stevie and I have traveled quite a bit throughout the world on global healthcare mission. And in those situations, and we still do, we don't count people, we don't count patients. If I may, these are God's children and we don't count them. Also the fact of the way the dental service here in this free clinic and Grand Avenue Free Clinic is set up, as I mentioned, we set up a treatment plan, and we will go clear through and do everything we can for them here. So that may be multiple appointments. We've seen up to 6, 7 appointments for a treatment plan, and so that will get them there. I think I also mentioned that I'm finding out a new avenue that I have very little skills in, but it's grant seeking, and you ask about support. We're looking for somebody that can help with grant writing and or that avenue of things. But as I try to wade my way through, I find out that most grant people aren't interested in specific numbers, mainly because really if you want to be of service, you try to take care of most of the needs. So they're more interested in what we refer to as ESPs, which is equivalent services provided. If these services were rendered in a private clinic, what would those fees be?
Okay. What do you get out of it?
Being blessed by following the Lord's calling.
I like your red.
Do you? Yeah.
Are you still a Chiefs fan?
Mm-hmm.
That's what I thought. They had a pretty good year.
Yeah.
You watched
The
them.
last 2-3 years they made it for playoffs.